diabetes is one risk factor. Diabetics have their immune system do not react as normal, so they are more prone to these infections. Also, there's of course the amount of sugar that's on blood and on the fluids. It's also very attractive for saying it's somehow to fungus, in this case candida. So that's a big risk factor. People that are taking steroids or any kind of treatment that might lower the immune system are at a higher risk factor. People taking antibiotics, especially if they're used for a long term, because of course the purpose of antibiotics is killing bacteria. And as I mentioned, the microbiota, it's made of different types of bacteria that they're not harmful, but of course antibiotics cannot choose which type of bacteria they're gonna kill. So sometimes they might reduce the population of some good bacteria, and then yeast, candida overgrows. Using tampons or any other object that might occlude the normal flow of any secretion that is produced in the vagina. It's especially if it's there, if you put it and you leave it there for a long time, it's a risk factor. And the number of basically the amount of sex that you're having. Of course, the more you have, the more risk you have it for many reasons. But of course, we have to remember that basically the penis is a foreign object that has its own pH and its own kind of bacteria. And obviously semen is a secretion that also has different pH. So the more sex, the more chances you have to change the microbiota, and then it's easier for you to have a yeast infection.